Key points of bones of thorax. Introduction. Hello everyone. Today we'll study the bones of the thorax, the ribs. We'll classify them into typical and atypical ribs, discuss their features, attachments, and ossification centers. This is a high-yield anatomy topic. Bone typical ribs, 3rd 9th, attachment. Posteriorly right-pointing arrow thoracic vertebrae, 2 facets on head articulate with corresponding and superior vertebrae. Anteriorly right-pointing arrow sternum via costal cartilage. Features. Head right-pointing arrow 2 articular facets. Neck right-pointing arrow connects head to shaft. Tubercle right-pointing arrow facet for transverse process. Shaft right-pointing arrow curved, costal groove for neurovascular bundle. Ossification. 1 primary center, shaft, 2 secondary centers, head and tubercle. Right finger visual aid. Draw a rib with labels. Head, neck, tubercle, shaft, costal groove. Bone first rib, atypical, identification, shortest, broadest, most curved. Features. Single facet on head, T1 only. Superior surface right-pointing arrow grooves for subclavian vein and artery. Scalene tubercle for scalenus anterior. Attachments. Serratus anterior, scalenus anterior, scalenus medius. Ossification. Only 1 primary center, unique. Right finger visual aid. Sketch showing grooves for vessels and scalene tubercle. Bone second rib, atypical, longer than first rib, 2 facets on head. Feature. Rough tuberosity for serratus anterior. Right finger visual aid. Highlight serratus anterior tuberosity. Bone 10th rib, atypical, single facet on head, T10. Otherwise resembles typical ribs. Bone 11th and 12th ribs, floating ribs. Features. No neck or tubercle. Single facet on head. End freely in abdominal wall. Attachments. Abdominal wall muscles, quadratus lumborum, latissimus dorsi. Ossification. Only primary center in shaft. Right finger visual aid. Show floating ribs ending freely, no anterior attachment. Outro. And that's the complete overview of ribs in the thorax. Remember, typical ribs have 1 primary plus 2 secondary ossification centers, while 1st, 11th, and 12th ribs have only primary centers. These differences are exam favorites. If you found this helpful, like, share, and subscribe for more anatomy content.